Hey, future nurses. Welcome to the deep dive.
Ready to tackle lung cancer.
You bet.
We're going to arm you with everything you need to be amazing out there.
No sugarcoating, right?
Not a chance. This is the real deal for nurses who want to make a difference.
You know, it really hit me when I saw lung cancer is the #1 cause of cancer deaths worldwide.
Yeah, that's heavy. But that's why we're here. Got to understand it inside and out, especially for you guys on the front lines.
Makes sense. So we've got the two biggies, right? NSCLC and SCLC.
Right, non-small cell and small cell lung cancer.
But here's the thing that got me. Adenocarcinoma.
Uh-huh.
It's an NSCLC subtype, but it's the most common one we see in non-smokers.
Yeah, it throws people off because you always think smoking with lung cancer, but that's why we got to look deeper.
It's like being a detective, right?
Right.
Got to figure out the whole story.
Absolutely. Speaking of which, can't talk about lung cancer without talking about
Smoking.
bingo. 85, even 90% of cases come from smoking.
Oh, and I bet secondhand smoke counts too, right?
Absolutely. So think about that. You're not just helping your patient, you're protecting everyone around them.
Advocating for smoke-free spaces,
Yeah.
education, the whole 9 yards.
Nailed it. But you know, smoking isn't the only villain in this story.
Yeah, there's got to be more. What else do we need to watch out for?
Oh, we've got the industrial bad boys, asbestos, arsenic, even diesel exhaust. All can increase a patient's risk big time.
So construction workers, shipyards, manufacturing, all that. Got to get those details from patients.
Yep, got to dig into that work history. And then there's the sneaky one, radon gas.
Radon gas. Now, that's one I don't think about often.
Most people don't, but it's the second leading cause of lung cancer.
Wait, really? I mean, I know it can build up in houses and stuff, but that common?
It's naturally occurring, can't see it, can't smell it, but a simple home test can tell you if you've got it.
Wow. Okay. You know, this is making me realize that even something as basic as asking about their home environment can be super important.
You got it. Thinking outside the hospital is key, but there's still more risk factors.
Okay, lay it on me. What else?
Not as heavy hitters, but diet and genetics play their parts too.
So, like, poor diet makes them more vulnerable.
Right. And family history could mean a predisposition. It all adds up.
So really, every patient is like a puzzle, and we got to put all the pieces together to understand their risk.
Exactly. Now, to fight this enemy, we got to know how it moves. How does lung cancer spread?
We talking staging.
Yep. It tells us how advanced things are and helps decide on treatment. We use stages 1 to 4, with I being the least and 4 being the most advanced.
So stage I, it's all contained, hasn't gone anywhere.
Yeah.
Then what?
Stage 2, I think nearby lymph nodes.
Okay.
Stage 3, it's spreading further, maybe even to structures around the lungs.
Gotcha. And stage 4?
That's when it's gone distant to the bones, brain, you name it, metastasis.
Makes sense why staging is so important. It's like a map of where the cancer is, right?
Right. And that map tells us how we fight back. Surgery, radiation, chemo, all depend on the stage.
Okay, let's talk about those. How do we actually tackle each stage? What are our weapons, so to speak?
Well, when it's caught early, surgery is usually the first line of attack. But instead of getting into all the different types, let's talk about the idea of lung-sparing surgery.
Lung sparing.
Yeah, it's about preserving as much healthy lung tissue as possible.
So not always removing a whole lobe or even a whole lung.
Exactly. They're getting much better at targeting only the affected part.
The more lung function they keep, the better, right?
Absolutely. But sometimes surgery isn't an option, or it's combined with other treatments like radiation.
Right, radiation. That's like super-powered X-rays targeting
Yeah.
those cancer cells, right?
Right. Stops their growth in their tract.
Can be used before surgery to shrink a tumor, after to mop up any stragglers, or even as the main treatment sometimes.
You got it. And then there's chemo, the big guns, when cancer cells are throughout the body.
Chemo's tough, though. Lots of side effects. What do we need to be most aware of as nurses?
Number one, chemo weakens the immune system, making them super susceptible to infection.
So even a little cold could be dangerous.
Exactly. We got to be on high alert, watching for any sign of fever, chills, anything unusual.
We're like their shield, protecting them while they're fighting this battle.
That's a great way to put it. And then there's the long-term stuff too. Fatigue, nausea, hair loss, all that really impacts their quality of life.
And that's where support comes in. Being there for them, listening, helping them through the rough patches.
Absolutely. And you know, we haven't even touched on the newer stuff, immunotherapy. It's really exciting, but that's a whole other deep dive.
Wow, this is a lot. But it's amazing to see all these different ways to fight lung cancer. Makes you realize there's hope, right?
Definitely. And there's a lot more to explore, especially when it comes to what you guys can do. So why don't we take a break, come back, and get into the nitty-gritty of nursing care?
Sounds good to me. We'll be right back. Okay, so we've laid the groundwork, all the basics of lung cancer. Types, staging, treatments, the whole shebang. But now, let's get real. You're in your clinicals, you walk into a patient's room, they just had lung surgery. What's going through your head?
It's where the rubber meets the road, right? All that book knowledge, now you got to apply it. So you walk in, patient's post-op. What's your top priority?
I mean, part of their lung is gone, so breathing right. Got to make sure they can breathe.
100%. Their whole respiratory system's been through the ringer, plus major surgery. So yeah, you're laser focused on that breathing.
So we're talking vital signs constantly. Respiratory rate, oxygen saturation, listening to their lungs.
All of it. And not just numbers, looking for any little change. Shortness of breath, breathing too fast, even their skin color.
Oh, and those chest tubes we talked about before. Can't forget about those.
Yeah, those are a big one. It's one thing to read about them, another thing to actually be responsible for them, making sure there's no kinks, checking the drainage, watching for any sign of a pneumothorax.
Collapsed lung, right?
Exactly. So you're monitoring their breathing and managing this whole other system at the same time.
It's a lot. No wonder lung cancer patients need such specialized care.
It is. And we haven't even touched on pain management.
Oh, yeah. I can't imagine how much pain they must be in after lung surgery.
It's intense. And it's not just about comfort, it's about helping them recover.
Because if the pain's too bad, they can't breathe deeply, which can lead to, what was it, atelectasis.
You got it. Part of the lung collapses. So pain management is crucial. You're constantly assessing their pain, adjusting meds if you need to, using every trick in the book to help them feel better.
Repositioning, relaxation techniques, maybe even a little back rub if they're up for it. Got to combine those nursing skills with just plain human kindness.
It's all connected. And speaking of getting them moving, early mobilization after surgery is huge.
To prevent blood clots and pneumonia, right?
Exactly. But getting someone who just had lung surgery to get up and walk around, that can be a challenge.
I bet.
That's where your communication skills shine. Explaining the benefits, setting small goals, lots of encouragement.
It's all about that trust, showing them you're on their side.
100%. And that support continues after they leave the hospital. Lung cancer and the treatments, they can cause all sorts of lingering symptoms.
Okay, like what? Give me the rundown.
Well, fatigue is a big one. Chemo and radiation can just wipe people out. Then there's the cough. Sometimes it's just relentless and debilitating. And of course, shortness of breath, especially after surgery or if the tumor is affecting their airways.
Right. And pain. Not just from the surgery, but from the tumor itself or even the treatments.
You're on a roll. And as nurses, we're the ones assessing these symptoms, making care plans, giving meds, teaching them how to manage things at home.
So let's say a patient's dealing with fatigue. What can we do?
First things first, make sure there's no other medical reason. Anemia, infection, gotta rule those out. But if it's really from the treatment, well, we can encourage rest, help them prioritize what they need to do, make sure they're eating enough, getting enough protein.
So working with a dietitian could be helpful. I'm also thinking about how demoralizing fatigue can be.
Absolutely. It affects them physically and emotionally. Sometimes just listening, letting them know their feelings are valid, that can make a world of difference.
It's about treating the whole person, not just the disease. What about cough and shortness of breath? How do we help with those?
With cough, first got to figure out why they're coughing. Mucus buildup, irritation from radiation, something else. Then we target the treatment. Maybe it's over-the-counter stuff, showing them how to clear mucus or meds to reduce inflammation.
Shortness of breath sounds scary.
It can be. Again, gotta find the root cause. Is there fluid in the lungs? Tumor blocking an airway? Might need a thoracentesis to drain fluid or meds to open things up.
And if it's the tumor itself and we can't fix it?
Then it's about helping them manage the best we can. Oxygen therapy, positioning them so it's easier to breathe, constantly checking their comfort level.
Wow, this is making me realize lung cancer nursing, it's like being a detective, a teacher, a counselor, all rolled into one.
You're getting it. It's a multifaceted role, that's for sure. And there's one more layer we can't forget, the emotional and psychological impact. That's where you guys, as nurses, really shine.
Right, it's a heavy diagnosis. Fear, anxiety, sadness, maybe even anger. It's a lot to process.
Definitely. Everyone handles it differently. Our job is to meet them where they're at, be supportive, no judgment.
Okay, so how do we do that? What are some practical ways to offer emotional support?
Sometimes it's the simplest things. Just being present, really listening, acknowledging how they feel, letting them know it's okay to feel whatever they're feeling.
Just that human connection, that can be so powerful.
It really can. And don't be afraid to ask directly how they're doing emotionally. Just opening that door can be a huge relief. But we have to go beyond just basic support too.
I mean,
Think about communication. Clear, honest communication. Patients need to understand what's happening, what their options are, what to expect.
so explaining things clearly, no medical jargon, taking time to answer their questions, being patient.
Exactly. And it's not just about the facts. Addressing their fears, acknowledging their concerns, helping them make informed choices about their care.
And that includes those tough conversations about end-of-life care, right?
Yeah.
Those are never easy.
They're not, but they're crucial. Sensitivity, tact, understanding the patient's values and beliefs, and it's often a team effort. Social workers, chaplains, palliative care, we all work together.
But nurses are often the ones coordinating everything, making sure the patient's wishes are respected.
Absolutely. But there's another level of advocacy that's important here, and that's on a bigger scale.
What do you mean?
We got to make sure our hospitals have the resources patients need. Mental health services, palliative care, support programs, these things make a real difference, and we have a voice to advocate for them.
It's about looking beyond the individual patient and trying to improve the system as a whole.
Exactly. But in all of this, we can't forget the most important person, ourselves.
You mean taking care of ourselves as nurses?
You got it. You can't pour from an empty cup. If we don't take care of our own emotional and mental health, we can't give our patients the care they deserve.
So prioritizing self-care, exercise, sleep, time with loved ones, setting boundaries, it's essential, not selfish.
Couldn't have said it better myself. It's about finding that balance, that renewal, so we can show up as our best selves.
Wow, we've covered a lot. Eye-opening to see just how much goes into caring for lung cancer patients. It's the medical knowledge, the human connection, the advocacy, all of it.
You nailed it. It's complex, it's demanding, but it's also incredibly rewarding. And for you, future nurses out there, the biggest takeaway is this. Never underestimate the impact you can have.
That's powerful. So to all our future nurses listening, keep learning, keep asking questions, and never lose sight of the human side of things.
And with that, I think we've pretty much covered the waterfront on lung cancer care. But I do want to leave you with one final thought, something to really chew on as you move forward in your careers.
So much of what we've talked about today comes down to communication, right? Especially when it comes to those really tough conversations about prognosis and end-of-life care.
Absolutely. It's where the art of nursing really shines. It's about finding that balance between honesty and sensitivity.
Because you have to be realistic, but also give them hope, right?
Exactly. And remember, every patient is different. Some want to know everything. Some just want the bare minimum.
So really listening to what they need, meeting them where they're at emotionally.
You got it. And don't be afraid to show your own empathy. Let them know you care, that you're there for them.
It's okay to say, this is really tough, or I can't imagine what you're going through, right?
Absolutely. Authenticity goes a long way. But also, remember your role. You're not a therapist, you're a nurse. So when those emotions run high, when patients are really struggling, that's when you bring in the experts.
Right, like the social workers, counselors, support groups. We talked about those before.
Exactly. You're the link connecting them to those resources.
But what about those really, really tough conversations, like end-of-life care? When it's clear that treatment isn't working anymore, those always feel so heavy.
They are heavy, but they're also incredibly important. And honestly, sometimes the most compassionate thing you can do is help a patient shift their focus from fighting the disease to focusing on their quality of life.
So helping them understand what palliative care is all about: comfort, pain management, emotional support.
Exactly. It's not about giving up. It's about making the most of the time they have left. And remember, it's not just about the patient. It's about the family, too.
Supporting the whole family unit, making sure everyone's on the same page, that everyone feels heard.
You got it. And sometimes that involves having those difficult conversations with family members as well, helping them understand the situation, making sure they're coping okay.
Wow, it's a lot. I'm realizing more and more that lung cancer nursing is so much more than just the technical skills. It's about that deep human connection. Couldn't agree more. It's a privilege to be part of someone's journey, especially at such a vulnerable time. But remember, in order to care for others, you have to care for yourselves too.
Self-care. We touched on this before, but it's so easy to forget when you're caught up in the demands of the job.
I know, but it's not optional, it's essential. If you're burned out, exhausted, emotionally drained, you can't be fully present for your patients.
So making time for yourself, doing things that bring you joy, setting boundaries, saying no when you need to.
All of that. It's not selfish, it's self-preservation. And honestly, it's the best gift you can give your patients because when you're taking care of yourself, you can show up as the best version of yourself for them.
You know, this whole deep dive has been so eye-opening. I feel like I've gained a whole new perspective on lung cancer and the incredibly important role nurses play in caring for these patients.
I'm glad to hear that. And for all our future nurses out there listening, remember this. You are the heart and soul of healthcare. Never underestimate the impact you have, the difference you make every single day.
That's a great note to end on. So, to wrap things up, keep learning, keep asking questions, and most importantly, never lose sight of that human connection. That's what makes nursing so special.
Couldn't have said it better myself.
Until next time on The Deep Dive.